Autoimmune diseases are relatively common in the United States. It's estimated that approximately 5 to 8% of the US population is affected by autoimmune disorders, which translates to about 16 to 26 million people. However, the exact prevalence can vary depending on the specific autoimmune disease. Some of the most common autoimmune diseases include 1. Rheumatoid arthritis affects about 1.3 million people. 2. Type 1 diabetes affects around 1.6 million Americans. 3. Systemic lupus erythematosus, SLE, affects roughly 200,000 to 300,000 people. 4. Multiple sclerosis affects about 1 million people in the US. 5. Celiac disease affects about 1 in 133 Americans, roughly 1% of the population. 6. Hashimoto's thyroiditis. Prevalence is around 1 to 2% of the population. Autoimmune diseases disproportionately affect women, with around 75% of those diagnosed being female. The annual costs associated with autoimmune diseases in the United States are substantial. These costs include direct medical expenses, such as hospitalizations and medications, as well as indirect costs, like lost productivity and long-term care. Here's an overview of the estimated annual costs for some of the major autoimmune diseases. 1. Rheumatoid arthritis, RA. The annual cost per patient is estimated to be around $10,000 to $30,000, depending on disease severity and treatment. Nationally, the total annual costs for RA range from $19 to $23 billion. 2. Type 1 diabetes. The total annual cost for managing type 1 diabetes in the US is estimated at over $14 billion, with an annual cost per patient of around $9,000 to $16,000. 3. Systemic lupus erythematosus, SLE. The annual cost of lupus can range from $12,000 to $63,000 per patient, depending on disease severity. Total costs nationally are estimated to be around $3.3 billion annually. 4. Multiple sclerosis, MS. The annual cost per patient is around $60,000, with total national costs estimated at over $28 billion annually. 5. Celiac disease. While the direct costs are relatively lower, about $5,000 per patient annually, indirect costs such as lost productivity and dietary changes can increase the economic burden. Total national costs can range up to $15 to $20 billion annually. 6. Hashimoto's thyroiditis. Treatment and monitoring costs can vary, but for patients requiring hormone replacement, the annual costs are relatively low, around $1,000 to $2,000 per patient. However, with millions affected, the total costs can reach several billion dollars annually. Overall, autoimmune diseases are estimated to cost the U.S. economy around $100 billion annually, factoring in both direct healthcare costs and indirect costs like lost productivity. This economic burden is comparable to other major chronic diseases, such as cancer and heart disease. The increasing prevalence of autoimmune diseases in recent years is a subject of debate, with evidence pointing to both factors: an actual increase in cases and heightened awareness leading to better diagnosis. Actual increase in prevalence. Environmental factors. There's growing evidence that environmental factors like pollution, changes in diet, increased use of antibiotics, and other modern lifestyle changes may be contributing to the rise in autoimmune diseases. The hygiene hypothesis suggests that reduced exposure to infections in early life due to improved sanitation may result in an immune system more prone to attacking the body's own cells. Genetic susceptibility. While genetics play a role in autoimmune diseases, genetic changes alone over a short period, a few decades, are unlikely to explain the increase. However, environmental triggers acting on genetic predispositions could be leading to more cases. Increased triggering agents, changes in food processing, chemical exposure, and the modern lifestyle may act as new or increased triggers for autoimmune conditions. Increased awareness and better diagnosis. Improved diagnostic tools. Advances in medical diagnostics, such as better antibody testing and imaging technologies, have made it easier to detect autoimmune diseases that may have been missed in the past. Increased awareness among physicians. There is now a broader understanding among healthcare providers of the signs and symptoms of autoimmune diseases, leading to more diagnoses. Public awareness. With greater media coverage and patient advocacy, people are more aware of autoimmune conditions and more likely to seek medical help for symptoms they might have previously ignored or attributed to other causes. Conclusion. The increase in reported cases of autoimmune diseases appears to be driven by both an actual rise in the number of people affected and improved detection. It's a combination of modern environmental changes that may be triggering these diseases more frequently and heightened awareness that is helping to diagnose them earlier and more accurately. Mortality rates associated with autoimmune diseases can vary widely depending on the specific disease, severity, and access to treatment. While many autoimmune diseases are chronic and manageable, some can lead to increased mortality rates, particularly if complications arise. Here are mortality rate details for some common autoimmune diseases in the US. 1. Rheumatoid arthritis, RA, mortality rate. Rheumatoid arthritis can reduce life expectancy by about 10 to 15 years, particularly in cases with severe disease. People with RA have a 1.5 to 2 times higher risk of premature death compared to the general population, often due to cardiovascular complications or infections related to immunosuppressive treatments. Number 2, systemic lupus erythematosus, SLE, mortality rate. Lupus has an overall 5-year survival rate of about 95% and a 10-year survival rate of around 90%. However, severe cases of lupus can lead to complications like kidney failure, cardiovascular disease, or infections, which can increase mortality. Young women with lupus have a 2 to 3 times higher mortality rate compared to their counterparts without lupus. 3. Multiple sclerosis, MS. Mortality rate. Multiple sclerosis can reduce life expectancy by an average of 7 to 14 years. Mortality is often linked to complications such as infections, respiratory issues, or cardiovascular disease. However, most people with MS live for decades after diagnosis, and modern treatments can help manage the disease more effectively. Number 4, type 1 diabetes, mortality rate. Individuals with type 1 diabetes have a higher mortality rate compared to the general population, especially if blood sugar levels are not well controlled. Complications like cardiovascular disease, kidney failure, and diabetic ketoacidosis are common causes of death. On average, life expectancy is reduced by about 10 to 20 years compared to those without type 1 diabetes. Hashner 5, celiac disease. Mortality rate. Mortality in celiac disease is relatively low if the disease is well managed with a strict gluten-free diet. However, untreated celiac disease can lead to complications like malnutrition, cancer, e.g., small bowel lymphoma, and other autoimmune diseases, which may increase mortality risk. Studies show a slight increase in mortality rates compared to the general population, particularly in those who are undiagnosed or do not adhere to a gluten-free diet. 6. Hashimoto's thyroiditis. Mortality rate. Hashimoto's thyroiditis generally has a very low mortality rate, especially with appropriate treatment, e.g., thyroid hormone replacement. However, if left untreated, complications such as severe hypothyroidism can lead to life-threatening conditions like myxedema coma, although this is rare. Summary. Overall, while autoimmune diseases can increase mortality risk, advances in treatments and management have improved survival rates for many conditions. The exact impact on mortality varies depending on the disease, its severity, and how well it is managed. Early detection and appropriate treatment are critical in improving outcomes for those affected by autoimmune diseases. Indirect costs of autoimmune diseases in the US are significant and often exceed direct healthcare expenses. These costs include loss of productivity, long-term disability, lost income, caregiving expenses, and other societal impacts. Here's a breakdown of the major components of indirect costs. Sh1. Loss of productivity, work absenteeism. Individuals with autoimmune diseases often require time off from work due to flare-ups, treatment, and medical appointments. This leads to lost wages and productivity for both the individual and their employers. Work presenteeism. Even when at work, individuals with chronic autoimmune conditions may be less productive due to pain, fatigue, or cognitive impairment, contributing to lower overall workplace efficiency. Early retirement and disability. Many individuals with severe autoimmune diseases are forced to reduce their work hours, switch to less demanding jobs, or retire early due to disability. For example, rheumatoid arthritis and multiple sclerosis can significantly impact an individual's ability to maintain employment. 2. Long term disability. Social Security Disability Insurance, SSDI. A large number of people with autoimmune diseases rely on long term disability benefits. Conditions like multiple sclerosis, lupus, and severe rheumatoid arthritis are leading causes of disability claims in the U.S. Private disability insurance. Employers and individuals often bear additional costs through private disability insurance payments to support those unable to work due to autoimmune related disabilities. 3. Caregiving costs. Informal caregiving. Family members often take on caregiving roles for individuals with autoimmune diseases. This unpaid caregiving results in lost income for the caregivers and additional strain on families. Professional caregiving. In more severe cases, professional caregivers may be required, adding to the financial burden on families and the healthcare system. 4. Lost income. Reduced lifetime earnings. Individuals with autoimmune diseases often experience reduced lifetime earnings due to missed work, early retirement, or reduced work hours. This not only impacts their financial stability, but also reduces contributions to the economy through taxes and spending. Impact on families. Autoimmune diseases often affect younger adults, impacting their ability to provide for dependents, save for retirement, and accumulate wealth, creating long-term financial challenges for families. 5. Healthcare system strain, increased insurance premiums. The chronic nature of autoimmune diseases can drive up healthcare costs, leading to higher insurance premiums for employers and employees alike. Public assistance programs. Many individuals with autoimmune diseases rely on public assistance programs like Medicaid, Medicare, and disability benefits, creating a financial strain on state and federal resources. Estimated indirect costs. Indirect costs of autoimmune diseases in the U.S. are estimated to be between $50 and $70 billion annually. These costs can vary depending on the disease, its severity, and the age of onset. In many cases, the indirect costs can exceed direct medical expenses, underscoring the wide-reaching impact of these conditions on society. Conclusion. The indirect costs of autoimmune diseases extend beyond healthcare expenses, affecting individuals, families, employers, and the broader economy. Addressing these costs requires comprehensive strategies, including better disease management, workplace accommodations, and support for caregivers to help mitigate the long-term economic impact of autoimmune conditions.